Welcome everyone to Beauty and the Surgeon podcast. I'm Amy, I'm a nutritional therapy practitioner, and I'm here today as always with Dr. Jason Martin. He's a board certified plastic and reconstructive surgeon. Dr. Martin, how you doing?
Pretty good. How you doing?
I'm doing good.
We're social distancing. We're dealing with the COVID crisis. I mean, did we ever imagine that we would be in this situation?
Not really. And if you see us both looking over to the side here quite a lot, it's because Nils' chair is empty.
Beer on the curb.
Yeah. Nils is...
Where are you, Nils?
Right. He's isolating at home, which is very smart. So we are, might look a little different today because I am the producer today and I'm not as skilled as Nils and I also don't have his fancy equipment. So.
Exactly. So we're technically working from home from the office. Just so you know that...
I can't.
What is it?
It was like a piece of hair. I don't even know what it was, but I couldn't keep looking at it.
We don't see any human beings, so I have hair just coming out from everywhere. We have been working, so Amy and I are basically family members. We've been together from the start of this. So we've been working from home and also our office, which is currently shut down by order of the governor. We can take care of emergencies, but any regular things that we do, specifically on the cosmetic side, are not happening. So
maybe we should have a small disclaimer if you're listening to this. Obviously, this episode was filmed in April of 2020. It's been released on April 15th, which normally is tax day for everybody, but this year it's not. So if you're listening to this after all of this is over, this is a blast from the past that you'd probably rather forget. But if you're listening to it now, we hope that you can at least enjoy what we're talking about today. We're not going to be talking about surgery, really. So it's a little different than our normal podcast, but it's a little different world than our normal world. So.
Yeah.
So yeah.
So we're all adjusting.
We are.
Even on the podcast side.
Yes.
All right, so what are we talking about today?
Well, today we're just going to talk about basically what we've been up to.
Okay, cool.
And then we're going to answer a couple of questions from listeners that we've had. And one of them is really great because it was a question that both you and I answered individually, but our answers are almost identical, which was really funny. I found that out yesterday. I'm like, wow, we've been working together for a long time.
Way too long.
Yeah. And it shows. So first we're just going to kind of talk about what we've been up to because that's kind of what everybody is talking about these days. Right.
So we're in the middle of the COVID-19 viral pandemic of the world. It's been extremely destructive to our daily lives, to the economy, and most importantly, to people's health, especially in the United States. What day is this? I don't even know what day we are.
It's the 10th.
So we're recording this on the 10th. The United States has the most deaths in all countries across the world. That's because we're probably one of the more populated countries. You don't really know some of the Asian countries. You may not get the full idea of the number of deaths. We're smack dab in the middle of the lockdown. Almost all states, I think maybe there's 4 to 5 that don't have shelter in place, but almost all states have shelter in place. So anyone listening to this in the United States is probably sheltering in place, about to strangle their kids if they have any, because they can't stand being next to them for any days longer.
See, I think that's a fallacy.
No, actually, to be honest with you, it's been wonderful for our family. Yeah, we've actually had a good time, but it's kind of running thin. So COVID-19 is a coronavirus. Amy and I we could do a whole episode on this virus and this pandemic. Amy and I research every day. We send YouTube videos back and forth to each other. We're not going to do that because there's some people that are true experts in the field.
We're not epidemiologists.
We're not epidemiologists or virologists, infectious disease doctors, ICU physicians. But basically, this is a serious problem. It really is contagious, and that's the main problem. The lethality or the death rate of all this kind of stuff we're still trying to discern that. It's different in different areas. It's definitely has a higher mortality rate than influenza, but it may not be as severe as we think at this moment, and we will see. But definitely how contagious it is the problem, which has led to this crisis, which is really a crisis of supplies for the healthcare workers and for hospitals and institutions. And that's where we are. Because it's so contagious that whatever percentage of people that end up in the hospital and whatever percentage of people of those go to the ICU, we're running up against an ability to take care of them because we're running out of supplies, because it's such this massive influx of people, patients.
And it's
into
not
the
like
hospital.
this is the only thing that's happening. Like
life still goes on.
We're still in the middle of the flu season. People still get injured. People still have accidents. Like it's not that this one thing comes in and all of a sudden all other diseases go away. And that's really the big problem. That's why I think people who don't understand like how quickly a hospital system can get overwhelmed, they think that hospitals just sit empty all the time, but it's not true. I mean, and all those same things that had people being admitted to the hospital ahead of time are still happening. And that's why there are, a lot of rules in place right now, specifically in our state and most states, about elective surgery, because they just can't waste the PPE on those patients. And, then if, there's always risk with surgery. Say someone goes in for a routine knee operation, gets an infection, and they're back in the hospital, then they need IND. Like it can kind of
expose them to more chances of them getting this problem. Yeah. And so that's why it's unprecedented. We've never, in my lifetime, we've never had a situation where we run into supply problems for healthcare ever. That I can remember.
Oh, that's not true.
No.
They just haven't on a broad scale.
No, on a broad scale. Yeah.
The saline issue was huge. That was nationwide.
Yeah. I mean, we've had hurricanes in Puerto Rico and
Hurricane Katrina
disrupted supply chains for certain things, but not on a grand scale like this. And that's where it's really hard for people to understand. So again, we're not going to get into the whole idea of it. So we have this really bad problem that it's real serious and people are dying. Okay. But the biggest problem is how contagious it is, and what that leads to in our health systems and our lack of supplies, and what that means for people like me, for physicians and office staff on the front line. We ourselves have realized that it's our duty as an office to also help the governor out in the country and make sure that we don't overuse supplies, that we do everything we need to do to get through this crisis also. So that's what we're doing. During that time, Amy and I have been stuck together.
Well, which is, it is definitely, our routines are different, but I mean, ultimately I feel like my daily routine has not changed much.
The only person I'm seeing is Amy and my family.
Yep.
We go to the grocery store and we make that as quick as possible. Other than that, we're staying home. That's like everyone else.
Yeah, it is.
And so, things that are new now are Zoom, right? It was there beforehand, but that's big, and people are reaching out, talking on FaceTime and Zooming and stuff. But, basically in human contact, it's Amy and my family. So if you want to know what I've been up to, we've been hanging out.
Yeah. Well, you have a little bit of a more dynamic situation in that you have kids that were in school when all of this started. And one who was actually on spring break.
Oh, yeah.
So you had a big lapse of like, this is spring break, this is exciting, straight into, you're never going back to school this year.
Yeah.
So that's definitely a big change for you guys. Like, how have your kids adjusted to doing school at home?
Kids are amazing. I have a 12, almost 13-year-old. Actually, he's 13. I'm sorry, he's a teenager now. He had his birthday in the middle of the COVID shelter in place, so that was interesting.
Along with all the rest of us Aries.
Yeah.
It's a real sad time to be an Aries.
It's terrible. And I have a 15-year-old. Yeah, they adjust. Fortunately, both of them their schools went to online, and actually the teachers still participated. A lot of public schools in Denver, there is no participation by the teachers. It's just online classes.
Well, or there are kids that don't have access to
and they don't have access to the internet, which is troubling.
Yep, or a computer. Like there's a computer with a camera. I mean, there definitely are limitations there for kids to have access to schooling if it is solely online, which I think we forget about, that not everyone has, 5G and Wi-Fi in their house. So there's definitely, I think, huge limitations for massive school systems. I think Colorado might be better set up for that than a lot of areas, but I can't imagine what it's like for kids that are in more inner city schools where like they just don't have that capability. I mean, how much of that suck right now? Like your prom's supposed to be this week, or like you're supposed to graduate next month.
No, graduation.
Yeah.
And my son goes to a school that only goes to 8th grade, and those poor kids, they don't get to celebrate their 8th grade graduation.
And what do you do when the school starts again? Like that's what I've been thinking. Like, man, like kind of sucks if you're one of these kids, because you miss out on like a few months of getting some education. But then what happens when your next grade starts? Are they gonna do a remedial like 3 months to get you back up to speed?
So someone said to me recently, don't futurize.
Yeah.
Don't say what if, right? Because I mean, literally with this crisis, you could do it with everything. I mean, college sports, which is the most meaningless thing. I love college sports. Like, I don't even want to get into that conversation.
Well, the NFL draft is supposed to be.
Are you kidding me? Are you kidding me?
And they're still going to do it. They're going to do a virtual draft.
I know.
Yeah.
So really what we've been up to is what everyone listening to this has been up to, stuck in your home, hanging out with family. And fortunately, I love my family and I have good relationships with them. So that's been good. Amy and I have been doing our things here in the office to get ready for the time when this stuff abates. We've also done telehealth through our office, which has been great to be able to connect with our patients that are current and actually future patients. We've had a lot of people reach out to us in this time of at-homeness.
Well, interestingly enough, I think people who may not understand what the restrictions are on elective surgery right now, people think it's a great time to recover. They're like, wow, I all of a sudden am home. Why don't I do my facelift now? And great idea. Like, let's do my tummy tuck right now. So it's been surprising. Like, at first I was really surprised. Like, when I was calling patients and changing them to telehealth appointments,
A lot.
we were packed, and people were like, well, can I just come in next week? And I'm like, I doubt it, but let's move you and we'll see what happens, So those first couple of weeks were a real challenge just because we had so many patients to move. Had a couple surgeries that we needed to move, obviously. And, those patients were super understanding, some of them more on top of like the length of what this might look like than others, but now everybody is kind of used to it, and people are really excited to do telehealth appointments. And for us, and this is what I tell patients when I schedule them, it's really exactly the same. Like, everything that happens during your normal
I don't
consultation.
think we're going back from telehealth, by the way.
Happens now.
Yeah, because you see these patients, they're in their home, and at least on the cosmetic surgery side, reconstruction is a little bit different, but cosmetic surgery, you can get most of the things from telehealth.
You can, and
There's a few things you can't, but a majority of the stuff you need to tell a patient about what they need, you can get from telehealth. And it's going to be hard to go back from this in medicine in general, but definitely with what I do. If the patient, wants to do a 10:30 appointment and say, obviously, maybe if you're at an office, you can't do that, but say they work from home already and they could just jump on a Zoom, or what we do is, what's our service? Ring Central, which is HIPAA compliant. And they could jump on Ring Central and we could do the exam there, and they would never have to come into the office.
Right. It saves a lot of time for patients. It saves on childcare. I think the other thing that's been really great too is obviously what we do, people are excited to have plastic surgery, but they're also really nervous. So it can be a very anxiety inducing thing to come into the office. Like, I've had numerous patients tell me like how terrified they were to come in the first time because they don't know what's going to happen. They're nervous. They feel like they're going to be like critiqued and criticized, or, we're going to say terrible things about their body, the things that they think in their own head about it. And being able to stay in the comfort of your own home, definitely you're more at ease. Your spouse can probably be there because, well, right now they're probably home too, but it just makes coordination a little easier. I mean, depending on where someone lives in Denver, even me, I live 3 miles away and it could take me a half hour to get here. Like, it cuts all of that out. So there's no travel time to get here.
Yeah, we're seriously considering green screening our office, And so each week we would have a different theme. Like, there'd be a video of an ocean in the background. That's where we're seeing patients this week. So it's been, there's always a silver lining in any kind of crisis or problem. And for this, it actually has been connecting with our patients. To me, personally, it's really been meaningful to be, stuck at home, all of us, somewhat under duress because of this problem, not knowing what the future holds with the economy and everything else, and being able to reach out to people that you care about. And we care about our patients, and being able to see them and know they're healthy and okay has meant a lot. So we've really enjoyed it. So that's one of the things. We have transitioned to telehealth, and we've been actually very busy in the middle of a crisis where we were basically shut down. As we said on our website, what did we say? Our physical doors are closed, but our virtual doors are open. That's such a great tagline.
That was all me.
Was that me?
That was me.
Was that me?
That was me.
Was that me? I think I did.
That was me.
I came up with that line.
No, that was
definitely
me.
Amy. That was her.
Yeah. So it has been fun. I mean, something else for me that everybody who knows me well knows that I am very routine oriented, and I would be at the gym pretty much every morning between 4:30 and 5 a.m. And that obviously has gone away, but it's been really interesting to see like how you can adjust your workouts. And for me, like kind of being able to mentally still function without having like an insane workout every single morning at the exact same time has also been a really good thing. Like, what, it's all right to sleep till 5.
So let's talk about it a little bit. I mean, let's make this episode something worthwhile for people listening. I think that all of us are struggling with a few things right now, right? Feeling isolated, right? Disruption in our normal schedule.
Routine.
And for us, this podcast is about health and fitness in some cases. And that's really important to both Amy and I. And that's been severely disrupted. And I know that a lot of people listening right now have had the same problem. And then also the associated stuff with isolation, not being able to work out, is really the mental health component. It really is.
It is for people who use that as their mental health outlet.
Right.
I mean, when this first happened, I was kind of had a moment where I was like sitting in my living room the first morning and I'm like, what do the people do who don't work out?
they have like an amazing life.
They
wake
do.
up.
They like meditate.
Oh, they wake up and there's a newspaper sitting there and like a
Yeah.
perfect cup of coffee and
Mhm.
there's birds chirping.
Yeah. Like,
Where you and I are at the gym at like 4:30 in the morning,
yeah.
nauseated because we're so tired.
Yeah. So I think there's a beneficial part of having your routine changed and like being able to get a different perspective on yourself and your habits and,
Yeah.
reevaluating all those kinds of things. And, to me, I think taking, anything as it comes and being like, okay, so this sucks, but I can't change it. So what can I do to make this sucky thing a little better?
Right.
And there are ways like you can do that. Something that I have found interesting myself as a nutritional therapist is my grocery habits. I feel like I never noticed that they were unusual before, but like now that people complain about the grocery stores being empty and I go and I'm like,
She's never has anything that's
seemed
empty.
fine to me.
I know.
Like, everything I want is still here. So if you need tips on what to eat right now, or if you're finding that your grocery store has nothing, and to be fair, I mean, I do feel fortunate that my grocery stores are not completely barren. I mean, I've seen pictures of, if you look down the aisles in the middle of the store where I don't go, they certainly are very empty, but the places where I shop have still been pretty full. And I also am very fortunate to have a ButcherBox subscription. ButcherBox is awesome. They are no
Yeah.
longer taking new subscriptions or new memberships because they are kind of at capacity, which I appreciate. But things like that, I feel really fortunate that I had that far before. I've been a ButcherBox subscription member for 7 years.
Yeah, I love
8
ButcherBox.
years, yeah.
So as well, we can't rep them because you can't get a new
You
subscription.
can't, but when this is all over, they're
Yeah.
super awesome.
So it's grass-fed,
Pastured.
pasture-raised animals, and that's where you get your meat from, and it's perfectly sourced or as best as it can be. So that's what we get too.
Yeah.
All right. So don't you think it's worthwhile to go through and give some people some tips while they're sitting at home, or is that not what your thought process?
No, go ahead.
Yeah.
Give people tips if you want.
So let's start with exercise routines. Clearly, you can't do your old one. So Amy said it's really good.
Well, that's not true. You might be able to do your old one.
Yeah, you might be
If you
able
did not work out at a box gym, you're probably just fine.
Exactly. You can go.
So
Listen.
you're a cyclist or a runner.
The best thing for isolation is go start running outside or walking outside, which I've been doing a lot more.
If you've never run before, it might not be the right
Or
time to
walk.
start a running routine. You don't
Just
want to get
walk.
injured right now.
One of the things Amy and I have found with exercise routines is shifting out into different types of exercises that are similar to what we were doing before has really stressed our muscles in different ways. And I personally have felt some of my exercises now are even more beneficial than what I was doing before.
Right. And I think a lot of that is, especially for more advanced lifters, if you understand what your muscles need to feel like to be working, you'll figure out a way to make them feel that way again with whatever you have. And for me, a really big key component is bands and just more reps. So if you, instead of doing like sets of 5 with really heavy weight on a back squat, if you can do like sets of like 40 or 50 with just your body weight and some bands, like you are going to get the same amount of burning in your muscles. It's just going to be, you're going to have to suck it up and work a little harder for it.
If you want to see some true creativity, go on the internet and like query like what people are doing at home to recreate exercises like leg press.
But be careful.
Yeah, be careful. Yeah.
If there's no point right now getting injured doing something stupid.
No, that's the other part of it. If you get injured, you have to go to the hospital and you're
Right, you don't want to do that.
technically get COVID. Okay.
Yeah.
So that's good. So we've enjoyed personally, really try to stick to your exercise routine. If you have to switch it out, switch it out. Cardio.
Another great resource that I personally utilize and have, again, for like 10 years is a yoga subscription called Yoga Download. Just yogadownload.com. Their slogan is, take yoga anywhere. And it is. And I've had it since we were in Aspen, a long, long time. And I love it. They have hundreds of classes in basically any style of yoga that you could even possibly imagine. They also have bar classes. They have Pilates classes. It's awesome. They have all lengths. You can search by a certain pose. Like sometimes I'll be like, what I really feel like doing today is a lot of like dancer, a lot of pigeon, and it's really fun. So many styles, and you cannot get any more economic than this because even I think your unlimited subscription is maybe $120. And if you do one drop-in yoga class, you're probably paying at least $30 for one class.
Yeah, I think there's a lot. That's a really good one. That's
and
probably the best
you're
one.
not going to hurt yourself.
No,
So
I
if
agree.
if you're new to exercise.
If you by chance have a Peloton bike, or I think you can actually sign up for the app itself. I'm pretty sure you can. Peloton has some really good yoga routines. I've done a few with my wife, and they've been really good.
Yeah, and even on YouTube, there are a lot of people that have just yoga classes on YouTube. The one thing I would definitely caution anyone about not doing, whether you're a new or advanced exerciser, is not start a crazy intense plyometric workout right now because you're going to be very prone to injury. And that's
So what
also
is plyometrics? It's like doing like, what is plyometrics?
jumping.
Okay.
Like things that are jumping, like tons of burpees.
So you're jumping up. Okay, please.
Yeah, like those things are going to be more prone
I don't
to
even want to
injury.
do those anyways.
Well, there's really,
Why start them now?
Exactly. And that's kind of the point. Like starting a crazy workout routine right now is probably not going to benefit your body a whole lot.
No.
Like do stuff that is safe and really support your CNS, support your stress levels. Like if you need to get out and like run, maybe just do some quick sprints. Like really fatigue yourself.
Well, I tell you what my wife and I've been doing is just walking.
Yep.
And walking gets into the thing I always bring up, which is forest bathing, where we're technically not walking in a forest.
You're city bathing.
City bathing, right? So you're outside in nature. It just really helps your mindset.
Mm-hmm.
And you get out, and the weather, fortunately, in Denver has been fairly mild here.
It's supposed to be 30 degrees and snow
I know.
in 2 days.
You don't have to remind me. So it's been good.
It always snows on my birthday. It's just a thing.
So trying to stick to an exercise routine is really important. If you don't exercise, even trying to do things that would not hurt yourself, like yoga, walking, anything like that is really important. These are
dancing.
really good for your head.
Yeah, put on some music and just dance.
Right. The second thing that I think Amy and I have been focusing on, or what we've been up to, is focusing on our nutrition. It's very difficult right now to get the nutrition the way you want it perfectly.
I just talked about how easy it is.
No. But I mean, for most people, I think. I mean, for you, it's different. But I think it's hard because they don't have direct access in a lot of cases to grocery stores. They have to rely on delivery services. And a lot of times, delivery services are either inadequate or late, or it's hard to get things in when you can. So you have to make do. And then in places that are harder hit, some people don't have, we've talked to people directly. They may not have stuff at the grocery store. But I think it's important. You said this to me, Amy, too. We talked about this. In terms of foods that people should look for, you said before with the really nutrition-dense foods. One of the things that I like is a Perfect Bar. It's small. How would you describe a Perfect Bar to everybody?
So it's a refrigerated bar. It's a whole food kind of meal bar. It's a base of either almond or peanut butter. It also has egg whites as the protein source and then some honey and other kind of nutrient additives that help increase its nutrient profile. So they're great. And you can actually make something yourself like that at home as well. So I'm a big fan of staying away from packaged foods if you can, but like for simplicity, if you need something quick, a Perfect Bar is a great option.
Right.
Like they're really good.
Yeah. Trying to pick out the things that are nutrient dense, as Amy said, things that come from the ground or which is morbid, that had a heartbeat.
Had a pulse.
Those kind of things are really, really important. And that's what I've been focusing on. So to really improve my nutrition during this time.
Yeah, right? So if the middle shelves of your grocery store are empty, which is what I hear they are, there's still a lot of food out there that you can eat. If you need tips and advice on what that is, reach out to me. I'd be more than happy to give you some ideas about what you should be eating right now.
Another thing that I think is important to concentrate on now is sleep, right? That's one of the things I've struggled with. Sleep is really important. And ways to get good sleep is not to drink a massive amount of alcohol at nighttime.
No, that'll put you to sleep, but that's not going to keep you asleep.
Does not equal a good sleep. So
no, it's very disruptive.
I know we're all caged up right now, and alcohol is the way out of that. But maybe don't. If you're going to have a night like that, that's fine. But next couple of nights, really concentrate on sleep. I got my chili pad. Have we talked about this before? My chili pad?
No, we've never talked about this.
Oh, I love my chili pad. So,
but why did you get it? Let's talk about why you got it.
Partly because you told me to get it, and
because it helps with
sleep, and what it does is it lowers your base temperature when you're sleeping. So it's a pad that gets chilly.
It has water that
runs through it, like your mattress pad. It's the same idea. And lowering your temperature actually can help improve your sleep. You go to sleep faster, and I think you have longer. Have they shown that you get longer? You get
more deep sleep, but
more deep sleep, yeah.
It's really important for people who may be concerned about neurodegenerative diseases because it helps bring down the temperature of your brain. When it brings down your body temperature, it also kind of cools off your brain at night, which allows it to not be inflamed. It helps things clear out, like with your microglia system and also your cerebral spinal fluid that's kind of constantly flowing around there. It kind of helps cool that all off.
Right.
So you hypothetically, and this is obviously things that they're postulating, not necessarily that have been proven, but if you can reduce the inflammation around your brain and the temperature, I mean, obviously if you I'm not saying you have inflammation of the brain. It's a very important distinction here. But it can just kind of help your brain flush itself at night better.
What if you're insane in the membrane?
Well, then you got to just jump around.
We've been stuck together too long right now. We need human interaction. All of Amy's jokes and my jokes, which we only
We
get,
think they're funny.
we think they're hilarious.
I mean, I guess that's good, right? We
So
think we're funny.
actually, Chili Pad's having huge discounts right now in sales. So if you're someone who struggles with sleep, and I don't know who that would be.
I don't know anybody who struggles with sleep.
Yeah, Chili Pads would be a great addition. It's really helped me out. Okay, so Amy.
What else helps you with sleep?
Gotcha.
Mm-hmm.
That really worked on podcasting, right?
Right, I know the people who aren't watching the video are like, there was silence.
We lifted our hands up and showed
our Oura rings.
Yeah, Oura rings. So Oura, and actually we should talk about companies that are awesome right now and during this crisis. So Oura is an amazing company. It's a ring that tracks basically your vital signs besides your O2 rate, your percentage. It tracks your vital signs during sleep. So that's your temperature, your heart rate, your HRV, and a few other things.
Which is heart rate variability.
Yeah. And it's really helpful for sleep. And then it really gives you your stages of sleep. So if stages of sleep are awake, which I used to spend a lot of time doing that in the middle of the night. Light sleep, which is like junk sleep. I don't like it, but Amy says you
light
need
sleep is necessary.
Boring.
You do need to have some
Don't
light
like
sleep.
it. I'm trying to be the best. Then deep sleep and REM sleep. Deep sleep and REM sleep is when you really get some improvements to your health. That's what you need to focus on. And that's where you get the downloading of the brain and the circulation in the brain. Everything, it's just improvement for your physiology of the brain and also your body. So this ring has really helped me and guided me into sleep and having better sleep. One of the things they're doing, Amy, that you clued me into is they're working with University of California, UC Health Systems, I think UC San Francisco, and they're doing a study related to COVID, meaning they're having you fill out forms every day, asking if you've had symptoms, and then they're taking your data and then correlating that with people that develop COVID and become symptomatic. And that's going to really help scientists and all the people involved in trying to stop this disease understand how this stuff progresses and maybe some signs and symptoms that we haven't already clued into.
Right, and just starting to see that like CNS stress or the really more sympathetic nervous system being on overdrive is a good indicator when someone's getting sick. So things like your resting heart rate, your overnight temperature, like those are things that can really cue you into like something might be going on, or even your respiration rate, like how many times a minute you're breathing. Even if you're not symptomatic, if those things are starting to increase, it's a good indicator that your body is in a little bit of like a stressed out state. So the things that ask you are really simple. It's literally just 2 questions. It gives you a list of symptoms, asks if you've had any of these in the last 24 hours, and also asks if you've been exposed to anyone in the last 24 hours who has had these symptoms or has been tested positive for COVID. So they're making, they're just trying to collect data. It's obviously we give up a little bit of our own privacy to join these kinds of things. It doesn't know anything about me other than the things that I've told it can know, and I answer these questions every day.
Yeah, and that's a big problem. At times like this could be the difference of really finding new things that could help stop the spread of this problem.
Yeah, or at least understand the path of the disease. And that's really what a lot of researchers are trying to look at now is, seeing how this disease shows up in the body, how it progresses, all of those kinds of things.
So Oura also is having discounts right now, big time. So if you were ever interested in buying an Oura ring, Oura, I would go on and look on their website. Yeah. Really, really cool. I love it. It's like the best thing I've gotten in a long time.
And as devices go, it's pretty easy. To wear.
And if you look on our YouTube channel, they're really nice, actually. Yeah. They look like normal bands, and they actually have a style to them. They're a little bit pricey, and maybe right now is not the time to buy pricey items, but if it's for your health, a lot of stuff that Amy and I have been reading about COVID-19 is the people that have really good outcomes are the people that have really good physiology,
have a healthy immune system.
Healthy immune system, specifically the innate immune system, and sleep is a big part of that. So Oura Ring.
Oura Ring's cool. A couple that I really like. I mentioned butcherbox.com, and they're super awesome. You can't subscribe right now, but I'm sure they'll be opening that back up more as time goes on. But it's Yoga Download. Yoga Download is an online subscription to yoga classes, and it's very, very economic. It's about $120 for an unlimited subscription for an entire year, which if you're doing a drop-in yoga class, I mean, it's going to be at least $20 to $30 for one class. And they have a variety of classes and a variety of yoga styles. And it's great for people who may not be, seasoned exercisers. You're not going to injure yourself. It's going to help with, there are actual studies. We talked about that in a couple podcasts ago about the studies on yoga and beneficial outcomes for stress, for flexibility, and all these things make a big difference in your life, as you age too. So this could be a great time to start a new habit of doing yoga in your own house, which is great.
The Peloton app has yoga. That's great. You can, I think, sign up for that, obviously, without owning a Peloton bike.
Yeah, that's way more expensive.
There's so many different things. There was another company that you talked about before with me.
Yeah.
You liked. Did we mention that before?
No, we didn't. So another company that really is doing amazing things right now, specifically related to helping people during this kind of crisis, is Core Nutritionals. Core Nutritionals is a supplement company, but they're super awesome. Their slogan is Crush It. So right now they're saying Crush Quarantine, and they have this really cool shirt that you can buy on their website that's just a hand holding like what looks like the COVID virus and like crushing it, which is super awesome. But they're a great company. I've known about them for a really long time. My very first coach ever, Tyler, was one of their sponsored athletes. And then Paul Revelia, who was our coach for a while, is one of their sponsored athletes. But they're really trying to give back in this time. So they actually put out a YouTube video a couple weeks ago, so probably around the first week of April, and have a phone number that they give out to like literally everyone. Like anyone who listens to this YouTube video has it, can call in and get advice from personal trainers and nutritionists and mental health care professionals. And I think that's such an important thing, is really finding ways through all of this that you can help people. And that's really what we're doing with telehealth too. We're not making money from our telehealth appointments, but we're doing it because we want to stay connected and help people.
Right. And we've told all of our patients, we're telling everyone listening to this podcast, if you're having a problem, especially with, a medical issue, and you can't get hold of your primary care physician, feel free to set up a telehealth appointment with us and we'll get you to the right person. A big part of this is the isolation. You're isolated, it affects your mental health gets affected, and then your health starts to go downhill. And that's what we do not want. So focusing on keeping some semblance of an exercise routine, really focusing on your nutrition right now, double down, and then focusing on sleep. And then most importantly, reaching out to friends and family and trying to make those social connections so we can get through this crisis together. That's what's most important.
It is. And, that really the people on the front lines, as we both have talked about, is so key. And there's another company to give a shout out to right now who is really doing amazing things to help people on the front lines, is actually Dunkin' Donuts.
Yeah.
So Dunkin' Donuts or just Dunkin', I guess they are now, but they are donating so much to hospitals. They're bringing coffee, they're bringing donuts and snacks. And you can, on their website or on their app, you can donate directly to them. Like, so you can buy gift cards for healthcare workers. They are really doing an amazing stand-up job of really helping. So is Dove, skincare company Dove is really helping as well, but donations and making sure the healthcare workers are getting the skincare that they need. When you wear a mask all day and a face shield and a cap and wearing all this PPE, it like destroys your skin.
Yeah, I'm still working in the ORs intermittently, and it's really difficult, to be honest with you, with what we have to wear now. It's uncomfortable. And the people on the front lines in the ERs and the ICUs, God bless these people. Amazing. And so anything you can do to support them, it doesn't always have to be financial. If you see a doctor or a nurse, more importantly, a nurse, a medical assistant, a radiology tech.
Even not that, somebody who's working administrative.
Whoever.
As healthcare professionals, like you kind of get into that because you love it. Somebody who works the front desk in the ER maybe just wanted a job.
Yeah.
And now they feel like, they're
Say
kind of right on the front lines. Yes.
Say thank you. They are the true heroes with this problem. And if we talked about it at the beginning, it's a supply chain problem. Okay. We will get through this. We will survive, but we don't have enough supplies. And that is a major problem that it could be 3 episodes of a podcast. We're not going to get into why that is occurring. There's some real problems that make me very frustrated. So I'm letting that go, Amy. Right. I'm letting that go because I'm being positive.
Unless you can change it.
Yeah, exactly.
You got to just...
All right. We're not going to... Okay,
yep.
T. But, the reality of it is thank them and support them any way you can. They are the true heroes. And I feel fortunate and blessed to be a physician, and I can help people. I took the Hippocratic Oath. This is very, very essential to who I am as a person. So thank you very much.
Well, and even just everyone else who is keeping, some semblance of the world running right now. Not just healthcare workers and firefighters and police officers, but even the people who are at the grocery store. Those people like look them in the eye, like say thank you. The people stocking shelves, like they're keeping things. Oh, the running.
Person the person that delivers the food, every time they come to the door, I just sit look at them through the door. I'm like, thank you so much for working. I really appreciate you. And they're looking at me like, okay, thank you. Yeah. It's almost, it's weird, but that's where we are now.
Yeah. And if that's the thing that we get that we keep going from all this is that we actually like acknowledge and see the people that are working and appreciate them for everything that they're doing. I mean, that would be a great thing to take away from this.
I agree.
Just like, we're all humans, like we're all people. And I think we sometimes like put on a good blinder about anyone that we interact with during the day, and we don't really see people and we don't really look at people, and, to kind of take a step back and like understand that we all are in this together at the moment. So, really appreciating that there are people who are working hard to make sure that we're safe, on the very front lines, the healthcare professionals, but also all the rolling it back from there, the administrative staff, the supply chain, people who are producing our food, people who are stocking our shelves.
People at Amazon. I mean, God.
Yep.
Everyone's
working hard.
I'm so thankful for everything that we have right now. So thankful. We didn't answer our questions.
We didn't, because we've gone a little long and I don't want Nils to kill us.
All right.
Without Nils here, I feel like we're going to get in trouble.
We're like a bunch of children.
Right. We're just
with no parent around.
He's going to be like, well, you guys have gotten podcasts for the next 3
you guys
weeks.
to understand, Nils would already have been over there like doing all this stuff, like what he does as a producer, like this, that, this. And of course, we didn't do what we set out to do. And you know what? It's okay. It's COVID time, baby.
This is the way
it's
the world
COVID
is now.
time, coronavirus.
But we do have, as I mentioned in the video, we do have some awesome questions, one of which I cannot wait to read what both you and I wrote back to this patient, because it is so almost identical. It's creepy, and we didn't talk about it. We responded to it at different times. It's really nuts.
Next episode will be, ask questions, and we'll get some more questions before then.
So if you have a question, like you can reach out to us through DM on Instagram is really the best way, or on YouTube if you leave a comment on this video. I see those too, but on Instagram you can do it at Beauty and the Surgeon Podcast. Obviously that's our main Instagram or podcast site for Instagram, and then also at Jason Martin MD and at Amy Gray, that's GRAYNTC.
Nutritional therapy clinician.
It was counselor, but now it's P. I just haven't had a chance to change it, so it should be
physician, clinician, whatever.
Right, nutritional.
She does nutrition.
Yeah, so we'll answer your questions about anything. I mean, I obviously can answer questions about nutrition, and there is one of the questions is about nutrition specifically, which will be great to answer next time. But if you have questions about surgery, obviously we can answer those. But just in general, I mean, this guy's pretty smart. He's also really artistic, and he plays the piano. So if you have questions about that,
right. And I will say, this is the time to rekindle all those old things. I was a fine arts major, and I've been drawing and playing the piano and doing things. It's like been a real silver lining. And I think the second thing, I think I said this before, but sticking to a routine. A lot of people are telling me now, I'm bored, I'm not doing anything. That's not good. At time of stress and crisis, you got to stick to structure. Okay, I'm a structure guy. That's the way I was raised. And so find structure in your life. If your day's not full with stuff, make it full. And if that's walking or focusing on nutrition or focusing on sleep or
about connecting with your neighbor or reading a book. The libraries are
6
closed.
feet away from your neighbor.
Oh, we didn't talk about that. The libraries are closed.
Don't get into
You can talk to your neighbor from afar.
Yeah, hey neighbor. We've been doing all that. Yeah. So that's really all I got. I think the last thing is, and I think we've hit on this before, but again, really just to reinforce, thank you to all the people on the front lines. It means so much to me personally. It's emotionally touching for me to read the stories of doctors like in Italy and what they're going through.
Or in New York.
in New York. And I personally have friends on the front line in New York who are physicians, and it means so much to me. And if I could transport myself there to help them, I would. And I mean that. So that's part and parcel with doing this for a living. And so thank you to those people. And hopefully one of them sees this and it makes them feel better. And that's so important to me right now. Well, that's all we got. So questions next.
Questions will be next episode.
Nils may not be here because we may be shelter in place still.
We might be doing this again on our own. So if you have watched this, thank you for hanging in there.
We don't need Nils.
People are like, yeah, you do.
Yeah, you do.
Yeah, you do.
The lighting's all messed up. The sound sucks.
Things are weird. At first I was like, what's wrong with the table? Like, it's because our mics aren't here.
I know, there's no table. I know, I'm going back and forth.
Yeah.
I was watching all the late night shows, and they're so funny because they're all doing it at home, and it's subpar lighting and stuff.
Well, it's like this.
It's like this. Okay.
So thank you so much, everyone, for listening. We hope that you at least enjoyed this podcast. If you didn't, you can definitely leave us some suggestions, or you can listen to our other podcasts that are far more produced.
One of the best things to do, don't watch Netflix. Listen to our entire bank of episodes.
Yeah, we have great episodes.
We have over 70-something.
Super educational, and we usually have really fun slides. This time we just had this one. But still, it was a good one. It was interesting. So
okay.
Thank you so much. You guys can find us anywhere you listen to podcasts. You can also watch us on YouTube at Jason Martin MD. Be sure to send us a question, leave us a comment, a rating, a review. We really do appreciate it. And we appreciate all of you for staying safe and staying at home.
Stay safe.